Causes, symptoms, diagnosis, treatment, and prevention of food poisoning. Introduction. Every year, millions of people all over the world suffer from the prevalent and widespread disease known as food poisoning. It happens when contaminated food or water is consumed, causing a variety of symptoms and health issues. We will explore the causes, symptoms, diagnosis, treatment, and prevention of food poisoning in this extensive manual. We will analyze the numerous organisms that cause foodborne infections, go over the symptoms that could appear, look at the diagnostic techniques used by medical professionals, go over the possible treatments, and offer helpful advice for avoiding food poisoning. List of contents. Food poisoning. What is it? Types of foodborne pathogens: bacteria, viruses, parasites, toxins, and bacteria. Contaminated food and water, improper food handling and storage, cross-contamination, and poor hygiene practices are some of the common causes of food poisoning. Food poisoning symptoms include nausea, vomiting, diarrhea, abdominal pain, fever, chills, headache, muscle aches, and dehydration. A medical history and physical examination, a stool sample analysis, a blood test, and imaging tests are all steps in the diagnosis of food poisoning. Medical care for food poisoning. Rehydration, medications, hospital complications, and long-term effects round out the list. Dehydration, reactive arthritis, Guillain-Barré syndrome, GBS, hemolytic uremic syndrome, HUS, and other consequences. Safe food handling procedures, appropriate cooking and storage, avoiding high-risk foods, water and environmental safety, personal hygiene, and travel precautions are all ways to prevent food poisoning. Organizations and regulations for food safety. International organizations A. National organizations B. Conclusion. What is food poisoning? Chapter 1. When someone consumes tainted food or water that is laced with toxic substances or hazardous bacteria, it is referred to as food poisoning, often known as a foodborne sickness. Humans may experience a variety of symptoms and health problems as a result of the presence of these infections or toxins in their meals. Food poisoning can happen everywhere, including at home, in cafeterias, restaurants, and even when traveling. It's critical to comprehend the various foodborne microorganisms that cause these ailments. Types of foodborne pathogens in Chapter 2. This chapter will give a general review of the various poisons and microbes that can lead to food poisoning. It will cover viruses like the norovirus and hepatitis A in addition to bacteria like Salmonella, Campylobacter, and Escherichia coli, E. coli. Additionally, it will go over germs like Staphylococcus aureus and Clostridium botulinum that create toxins, as well as parasites like Giardia and Cryptosporidium. Chapter 3. Typical food poisoning causes. Several factors, such as tainted food and water, inadequate food handling and storage procedures, cross-contamination, and poor personal hygiene, can result in food poisoning. Each of these factors will be thoroughly covered in this chapter, along with particular instances of how they can result in foodborne illnesses. Chapter 4. Food poisoning symptoms. Depending on the type of organism involved, the signs and symptoms of food poisoning can change. The typical signs and symptoms of food poisoning, such as nausea, vomiting, diarrhea, abdominal discomfort, fever, headache, muscle aches, and dehydration, will be discussed in this chapter. Additionally, the duration of symptoms and their incubation times for several foodborne infections will be covered. Identifying food poisoning in Chapter 5. Various techniques and tests are used by medical experts to identify food poisoning. The diagnostic procedure, which includes gathering medical history and conducting a physical examination, will be covered in this chapter. The significance of stool sample analysis, blood testing, and imaging tests in determining the causes of foodborne infections will also be discussed. Chapter 6. Food poisoning treatment. Focusing on symptom relief, avoiding complications, and promoting recovery are the main goals of food poisoning treatment. The main methods of treatment, such as intravenous therapy or rehydration by oral fluids, will be covered in this chapter. The use of drugs to treat particular pathogens and manage symptoms will also be covered. In serious situations, hospitalization can be necessary. Complications and long-term effects, Chapter 7. Some people may endure long-term repercussions and complications from food poisoning, despite the fact that the majority of cases end without them. This chapter will explore the possible side effects of food poisoning, including dehydration, reactive arthritis, Guillain-Barré syndrome, GBS, hemolytic uremic syndrome, HUS, and other less frequent side effects. It will shed light on their root causes, signs, and potential remedies. Preventing food poisoning in Chapter 8. In order to lower the prevalence of food poisoning, prevention is essential. This chapter will provide helpful advice and tactics for avoiding foodborne infections. It will go over how to handle food safely, how to cook and store food properly, how to avoid eating high-risk foods, how to ensure the safety of the environment and water, how to maintain good personal hygiene, and how to take the required safety precautions when traveling. Chapter 9. Organizations and Regulations for Food Safety. Numerous worldwide standards and national organizations have been developed to guarantee food safety. The major institutions and laws that contribute to guaranteeing food safety around the world will be clarified in this chapter. It will go over the functions of both national organizations like the Food and Drug Administration, FDA, in the United States and international organizations like the World Health Organization, WHO, and the Food and Agriculture Organization, FAO. Chapter 10. Final Verdict. We shall summarize the important ideas discussed throughout the guide in the last chapter. We will stress how crucial it is to comprehend food poisoning's causes, symptoms, diagnosis, treatment, and prevention. People can reduce their chance of developing foodborne illnesses and live better lives by taking the proper precautions. In conclusion, food poisoning is a major global public health issue. For individuals, healthcare professionals, and policymakers alike, it is vital to comprehend its causes, symptoms, diagnosis, treatment, and prevention. We can lower the prevalence of foodborne illnesses and safeguard people's health and well-being by implementing efficient preventative measures, encouraging safe food handling techniques, and upholding food safety standards. When you get food poisoning, what should you eat and drink? It's advisable to progressively delay eating solid foods until after vomiting and diarrhea have stopped. Instead, gradually return to your regular diet by consuming bland, easy-to-digest foods and low-fat beverages like sea salt crackers, toast gelatin bananas, oatmeal bland potatoes with rice, veggie soup, diluted fruit juices, ginger ale, or root beer without caffeine, chicken broth, sports beverages. What not to do? Even if you feel better, try to avoid eating the following difficult-to-digest items to keep your stomach from getting worse. Dairy items, particularly milk and cheese. A fatty diet. Fried food. High-spiced foods. Dishes that are hot and heavy in sugar. Avoid as well. Caffeine, alcohol, nicotine. The potential for food poisoning. Food poisoning can affect anyone. According to statistics, almost everyone will have food poisoning at some point in their lives. Some populations are more vulnerable than others. These consist of immune-weakened individuals. Anyone who has an autoimmune disorder or a reduced immune system may be more susceptible to infections and other side effects from food poisoning. Pregnant women. Because their bodies are adjusting to changes in their metabolism and circulatory system throughout pregnancy, pregnant persons are more at risk. Older people. Additionally, adults 65 and older are more likely to develop food poisoning. This is due to the possibility that their immune systems do not react promptly to infectious agents. Little ones. Because their immune systems are still developing compared to those of adults, children under the age of 5 are likewise seen as a population at risk. Vomiting and diarrhea can cause dehydration more easily in young children. How to avoid getting sick from food. The easiest approach to avoid getting food poisoning is to handle your food carefully and steer clear of any potentially dangerous foods. Due to the methods used in their production and preparation, some foods are more prone to result in food illness. Certain foods may contain infectious organisms that are destroyed after cooking, such as meat, poultry, eggs, shellfish. If these foods are consumed uncooked, improperly prepared, or if hands and surfaces aren't washed after contact, food poisoning may result. Additional foods that could result in food poisoning include unpasteurized milk, cheese, and juice, raw, unwashed fruits and vegetables, sushi and other fish items that are served uncooked or undercooked, deli meats and hot dogs that aren't heated, or cooked ground beef that may contain meat from numerous animals. Attempt to prevent food poisoning by following these steps. Be sure to wash your hands before handling food or cooking. Make sure your food is wrapped and kept appropriately. Cook eggs and meat to perfection. Before using it to make other foods, sanitize anything that has touch with raw foods. Always wash produce before serving it, especially fruits. Please like, share and subscribe.